Hello again. 12,000 additional healthcare workers are needed to fight COVID-19. The country is seeing a shortage of nurses and doctors. President Cyril Ramaphosa says that rural areas could be experiencing strain. We're joined now by DONOSA spokesperson, Mr. Simon Hlungwani. Thank you very much for joining us this afternoon, Babu Hlungwani. Do we have capacity?
Well, thank you for having us. We think our country is much strained now, particularly during this time, because we're seeing the surge growing so high. We don't have enough capacity. We are starting to overflow the wards, and we're getting reports from many nurses that there's a lot of patients that are receiving on daily basis, and there's a lot of patients dying on daily basis. We do not have enough capacity in our country to can admit more than what we have at the current moment. So the sooner we get the situation under control, where most people would not need admission, it's going to be better for us.
12,000 additional healthcare workers. In terms of nurses and the work that you do you foresee us meeting the target here?
We are not going to be able to meet that at the current moment, because the government has not been, from the past, training enough to cover the country. And you must remember that it takes 4 years, or in fact it takes 5 years to produce one professional nurse. But we can say that if there's still any nurses that are unemployed, can the government recruit them and also plan to recruit them? Because we are going to have a bigger problem if we don't plan to recruit them for our country. There's many nurses that are dying, many nurses are also getting the disease. So it is a problem for everyone. The virus is out there in the townships, in the rural areas, in communities, in the shops, it's all over. So we are also calling on government to make sure that we have a complete and full gear everywhere. We want an N95 mask everywhere, because we must treat everyone as if everyone has the virus or COVID-19 positive. So we must all make sure that we employ every precaution to make sure that we prevent any nurses getting the virus in the workplace. And we know that everyone is exposed, whether it's a public transport, the taxi or a bus. But anyone entering a hospital must meet nurses who are wearing an N95 mask and a complete full gear, because we must treat everyone as if they are having the virus, the COVID-19 positive as it were.
Earlier on ENCA, we spoke to the South African Medical Association, and they were talking about the emotional burnout that some of these healthcare workers are experiencing. What are some of your members telling you about the situation that they're facing on the ground?
Look, anxiety is at its highest, because nurses are fearing that what if I am the next one tomorrow? And it's painful to see people die on daily basis. And I can quote a nurse who called me and saying, Simon, I am very, very very stressed, because on daily basis we have 2 or 3 patients that are critical and they are dying of COVID-19, which is an abnormal situation, because you would know that when you send to the hospital, you expect that they will improve and get home. But right now, the number of people dying on daily basis are increasing. So that on its own is adding a stress over and above the fact that you are fearing, and there's more anxiety that even nurses are turning positive, even nurses are dying, so you don't know when you are next. So there's that issue where people are getting stressed. And we're calling for our employers to provide psychological support to the nurses of this country, because they are not coping as well. We are not coping, and we're a serious problem. We wish we can be assisted in this regard.
Aware of the situation in the most remote parts of our country, rural areas, specifically in terms of what nurses are experiencing there?
Yes, I am aware, and I can quote a few instances where there was a call I received from Tikundu Clinic, which is a rural clinic in Limpopo, and one nurse turned positive there, and the other nurses that were off duty, it compelled that those who were on duty on that day, because they were exposed, they must be tested or must be screened properly, and therefore they must no longer serve the community, and they are pulling those who were off to come to work. But the surprise was that they were called to come to work and nothing was done in that clinic before they could be called to work. So it was a situation that we faced on that day, but we do call upon for employers and even in the areas to make sure that they prevent the spread by so that before the clinic can be utilized, it is decontaminated in a proper way, like it's done. You see, when there's a case in a clinic, when there's a case in a hospital, it is differently from when there's a case in the police station and the school. They normally close the schools and they close police stations, and are not closed. But we are simply giving you they are not closed. Then this time we can make sure that at least they decontaminate those areas, because otherwise it means all the staff members are going to test positive, and it also means that every patient that is going to come being sick is going to get COVID-19. So we must do all in our power, including in person, to prevent anyone getting exposed from a healthcare facility.
The president of the Democratic Nursing Organization of South Africa, Bob Simon Hlungwani, thank you very much.